Hello and welcome to Medical Dialogues. I'm Mr. Zaman and today I'll talk about COVID-19 positive donor hearts may impact post-transplant survival, shows study. Heart transplant recipients receiving organs from active COVID-19 positive donors may have an increased risk of death at 6 months and 1 year when compared to those receiving organs from recently recovered COVID-19 patients and COVID-19 negative patients, according to a study published recently in the Journal of the American College of Cardiology. The study looked at more than 27,000 donors in the United Network for Organ Sharing between May 2020 and June 2022. In total, donors were given more than 60,000 COVID-19 tests prior to organ procurement. Of the donors in UNOS, 1,445 were identified as COVID-19 donors, of which 1,017 were classified as active COVID-19 donors and 428 were recently resolved COVID-19 donors. Overall, 309 heart transplants used COVID-19 donors and 239 of those met study criteria. Those receiving heart transplants from active COVID-19 donors had increased risk of mortality at 6 months and 1 year. Those receiving transplants from recently resolved COVID-19 donors had similar 6-month and 1-year mortality rates as those receiving transplants from non-COVID donors. Researchers also found that during the study period there was increasing use of COVID-19 donors, but that transplant centers were selective and mostly used donors who were younger and about 80% were male. Also, potential donors were tested for COVID-19 multiple times prior to organ procurement, with those who had at least one positive test receiving subsequent tests more often than those who tested negative the first time. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.